I will be looking at what difference has the national code made to the Brazilian roads.
Sao Paulo, the richest state in Brazil. 19 million people live in the city, which is struggling to cope with 500 new vehicles on the roads a day.
I've been on the Sao Paulo roads for the last few days, and I've seen the traffic is quite well managed. I want to know that how the Brazilian government was able to do it. Is it only the national traffic code which has made the difference, or is it much beyond that? I think political will is an important part of it.
Brazil has an advantage over India. It does have a national traffic code, passed in 1997. Initially, the new code brought the death toll down, but not for long. Paramedics now arrive at crash scenes like this in record time, saving hundreds of lives. But 35,000 Brazilians die in road crashes, and almost 500,000 are injured every year. Harman meets Eduardo Vasconcelos, who's just evaluated the national traffic code.
One of the main problems with the new highway code is that the mandate to control the traffic was devolved from the national government down to the local level. And the main issue here is that not every council has the ability to do this control properly. They lack technicians, engineers. They don't have the right resources in place.
Não têm engenheiros e não tem como organizar. Esse é dos grandes desafios.
Sao Paulo has the highest number of crashes in the country, around 25,000 every year. And as in India, motorcyclists, pedestrians and cyclists are the main victims. The phenomenon of motor boys, as they're known, exploded onto Sao Paulo's streets 10 years ago when unemployment was high. Now they compete for space on the city's massive network of roads and expressways. Every day, 25 motorcyclists are injured, at least one dies.
Many times it's the motorboys' fault because they aren't careful enough. They are aggressive, swerving in and out of the traffic. They want to go faster because many companies want them to deliver faster. The work has to be done, but they shouldn't behave like idiots because that's when accidents happen in the traffic.
To reduce the number of motorbike crashes, Sao Paulo's traffic department has created the country's first motorbike-only lane, a 2-kilometre stretch in the centre of the city. As in India, drivers in Brazil will have to accept that motorbikes are here to stay. Harman's visiting Dr. Julia Greve at Hospital das Clínicas, the largest hospital in the city. They receive around 600 road crash victims every month. 1 in 5 are spinal injuries, the majority young men. Most spend months in hospital and years in rehabilitation.
Why do you think people get these kind of injuries?
The injuries vary a lot. Here, crashes with motorcycles are the most frequent. The injuries are mainly upper leg and then head and chest injuries, but there are a huge amount of head and spinal injuries.
Da cabeça, de membros superiores e por último de tronco.
There'd be even more injuries if Brazil hadn't made helmets and seatbelts compulsory.
What are the social costs of these accidents on the country?
The total cost of accidents for the country in terms of public health, funeral costs, resources, loss of production and medical materials amounts to 22 billion reais or $11 billion.
That was lucky. It was my first time.
So how did you get your injury?
I was going to work on my motorbike and a bus made an illegal turn and I crashed into it.
So how has your life changed after this?
Everything has changed. Now I'm dependent on everyone for everything.
I was walking with my daughter and husband on the footpath, and a car hit me from behind and hit my right side. I had multiple fractures on the right side of my body and an injury to my head. We know alcohol is the cause of many accidents in Brazil. Many drunk drivers cause crashes. In my case, I don't remember because I was unconscious, but the police said the driver was very, very drunk and he couldn't remove the car from the sidewalk.
Among 14 to 26-year-olds, drink driving and speeding account for 3/4 of car accident deaths on Brazil's roads. Disa Gonzaga set up Vida Urgente after her son Tiago lost his life in a late-night driving crash. Over 3,000 volunteers have joined her, using the breathalyzer test in bars to spread the message that alcohol and driving don't mix.
Our symbol is a butterfly. The green one is given to those who pass the test to say they are safe to drive you. And those over the alcohol limit receive a red one with the phrase, "I've drunk everything and I want someone to drive me." And then we look for someone to drive them safely.
What's the limit? 3.
But passing the buck is as common in Brazil as it is in India and many other countries. The military police are still the only people allowed to administer breathalyzer tests to drunk drivers, not the local traffic police, who are the ones charged with enforcing the national code. Isn't that, Harman wants to know, a drawback?
The Department of Traffic has no power to control those driving under the influence of alcohol, so there's a little enforcement. This issue falls under the control of the military police.
Fiscalizar o motorista que dirige sob efeito de álcool.
As Brazilians continue to migrate to the cities in search of work, more and more neighborhoods are springing up next to the dangerous high-speed expressways leading into city centers. Every day, 21 pedestrians are run over and 2 die. Eduardo Darros fights for the rights of pedestrians on Sao Paulo's roads. Roads, he tells Harman, that were designed for vehicles without people in mind.
First priority should be given to pedestrians. Second priority to public transport. And third priority to services. Less priority to cars. In our avenues, the cars are driven at 60, 65 kilometers per hour, and the pedestrian can't cross. There is no zebra crossing. There are bus stops one side, on the other side, and no zebra crossing in the middle. And then the pedestrian, how they get into the bus? They don't get by parachuting. They get by walking.